guys. So the nice thing about having so few people is we can really just be really interactive. So if you've got any questions along the way or discussion points, let's just do it as we go. What I thought I would do is just obviously highlight, this is just general information. When I do these talks, people start going, like you're describing my child or my grandchild, and it's like, well, I'm not, but if you want to do it properly, we can do it properly. So anyway, so I'm an ear, nose and throat surgeon, and more specifically, I go deep dive into upper airway obstruction, particularly in children, but also in adults as well. And I'm going to be focusing on kids in this one because the condition or problem I'm going to be talking about, when you add up the numbers numerically, it is the most common chronic healthcare condition of childhood. Yet it's the most missed with regards to awareness and diagnosis and referral. So it's a bit of a problem. So what I thought I'd do is I'll just run through some stories. And these are actually real stories. The names have been changed to, well, no real reason really, just because I felt like it. So we're going to talk about Amy, 4-year-old girl. She was a sweet girl to a point, and then things started to change about 18 months ago. There were a few things that went off track. She started to be tired in the morning, was grumpy, taking forever to finish her meals. Parents are getting frustrated and just put it down to the terrible twos because that's just the age she was. 18 months later though, and obviously no longer 2 years old, she's gone, you know, they'd lost their angel. Their beautiful, sweet child was gone. Now, circumstances prevailing was that Amy's parents were going away on a holiday. So Amy was going to go for a sleepover with her friend's place, Sarah. At Sarah's place, you know, they've had a play and all those sorts of things, pyjama party, all those sort of things you do when you're 4, the sleepover. And then they sort of bunk down for the night. But then within about, well, less than an hour, Sarah's back basically getting out the room and going and found her mum to basically say she just couldn't sleep. And the reason she couldn't sleep was Amy was snoring like crazy. And she was tossing and turning, kicking and thrashing in the bed, and Sarah just was like, I can't sleep, she's so noisy and hitting me. So Sarah's mum went in and had a look, and then she could hear the snoring, so oh, no wonder you can't sleep, that's horrendous. But more so what she noticed was that Amy was actually choking. She actually was stopping breathing at times. Now, Sarah's mum had never heard or seen anything like this before, and because Amy was stopping breathing, she just called an ambulance because she was just in an absolute mad panic. She had no idea what was going on. The ambulance arrived, and with all the noise and commotion, Amy had woken up. So when the ambulance people checked her over, you know, sort of checked her breathing, checked her oxygen levels, they didn't really see anything. Said, well, you know, everything seems to be okay. Won't rush her to the hospital. She seems all right at the moment. So that was that. Amy went off to sleep again, but within 5 minutes she was breathing heavy again, and then she was stopping breathing again. Sarah's mum recorded it, so there was actually some documentation, which is the advantage of phones these days. And by that morning, Sarah's mum was just absolutely exhausted because she hadn't slept the whole night. She'd stayed up making sure that Amy would start breathing again, and sometimes poking and prodding at Amy to just get her to rouse, just to take another breath. And then when Amy's mum just came to pick her up, Sarah's mum just explained what a horrendous night it had been. Amy's mum had no idea what she was talking about. Just thought it must have just been a bad night. Maybe the girls, you know, just been playing up and being a bit silly. Different pillow, different bed, that sort of thing. So obviously Amy goes home, and her parents thought, well, let's just check things over. And then, because they haven't really done that, and that's not unusual because Amy went to sleep down one end of the house and the parents did everything else down the other end of the house. Pretty standard in households these days. But they were also shocked that night because Amy was indeed snoring horrendously and she was stopping breathing. And then it was Amy's parents' turn to have that restless, sleepless night as they prodded and poked their little girl to get her to breathe through the night. So they took her straight off to the GP the next day. GP sort of had to listen to the story, but then had a look. She wasn't sick. She didn't have any temperatures or fevers going on, and you know, just seemed well otherwise. They had a look inside the mouth, and then at the back of the throat they found these enormous tonsils. And the doctor said, well, by the sounds of things, Amy's got something called sleep apnea. Now, Amy's parents had no idea that kids could get sleep apnea. They thought it was an old man truck driver sort of thing. But the GP said, no, kids can get this and you need to go and see the ENT. So Amy's parents complied. So they got seen in the ENT clinic, had a good chat with the parents again. She'd had bouts of tiredness more often than not, so it was also moody, grizzled a lot, was becoming defiant, just no longer that angel that they'd had. The parents had no insight into the snoring at all, because, as I said, down one end of the house and the parents are down the other. Then going into it, they sort of said, oh yeah, she's got drool on her pillow a lot, and sometimes, you know, her bed was all messed up. Like they sort of knew that she was tossing and turning through the night, but never really thought much of it. ENT had a look, and the ENT found that there was actually fluid behind Amy's eardrums. Again, something the parents had no real idea about. They just thought Amy just wasn't paying attention and listening at times. It turned out she couldn't hear properly. And then the next thing was that looked inside the nose, which looked all okay, and then again inside the mouth, those really big tonsils. So Amy has sleep apnea, and she needs surgery, and she needs it quickly. So parents are like blindsided from this because they've gone from 0 to 100 in a short matter of time, but they're going, well, but she's never had tonsillitis. Why are we taking these tonsils out? So it's actually probably a good thing that Amy's not getting tonsillitis, because that would make these tonsils even worse than what they are. Okay, and if we look at ENT, there's two reasons we do things in the majority. For 80% of what we do, it's either because of infection or obstruction. Now, some have both. When it comes to removing tonsils in kids, 80 to 90% of tonsillectomies are done for breathing problems, not infection. Infection is by far a minor consideration in the decision process. So, as I said, getting the tonsillitis would have been worse, and the obstruction is a problem. It's basically a plumbing problem. It's not a contamination problem. This is a plumbing problem. So ENT went through the procedure and the risks involved, and apart from getting the tonsils and also what's called adenoids out, also had some of that fluid drained from her ears. And then within a month, she was a completely different child. It was a transformation of epic proportions. She was calmer. She was that angel again. She was zoned in, focusing, attention was better, was hearing and responding to the parents. And the parents basically, having had no idea, wished they had known that this condition was something that they need to be aware of. And the real importance that every parent should undertake is just checking their kids every couple of weeks, just as a routine, just in case these problems start to sneak in, so we can catch it early. So, what went wrong? Well, Amy has the broad condition is called sleep-disordered breathing, and that's a spectrum. It can include mouth breathing, it can include snoring, and it can include what Amy had, which was sleep apnea. So it comes in different shapes and sizes, and it's estimated that only 1 out of every 20 kids with this are actually diagnosed, which means 19 out of 20 never get picked up. That's a horrendous diagnosis rate with something that is, a real indictment of the healthcare system when we're missing that much. Amy's not sleeping properly. Anyone that knows if they had a bad night's sleep and they're tired the next day won't function well. Well, this was Amy for 18 months. Okay, and basically, this is her brain malfunctioning. All right, sleep is so important for brain function and health, which is what I'm going to talk about in the other talk. And these children have a spectrum of symptoms, so they can be struggling to stay awake because they're tired. Their concentration's a problem. They might even get diagnosed with having ADHD and being given medication for it. And in simple terms, the brain's not getting enough oxygen. Okay. And in simple terms, we've got a mouth and a nose, and both can be used for breathing, but it's the nose that is supposed to be used for breathing. and we're lucky we've got a backup system, but that should be a temporary backup system, not a permanent solution. I can go through the whole physiology of why nose breathing is so important, but let's just leave it as it is by far the way you're supposed to breathe. Nose breathing is far much better and healthier for you than mouth breathing. And roughly speaking, to give you an idea of the numbers, as I said, it's roughly around 20, maybe 25% of kids are not breathing properly at night. And sort of, why this is that you've got the tonsils that I've mentioned, but it could be due to hay fever problems. It could be problems due to the jaw growth and development. So let's give you a bit of background. So sleep disordered breathing, okay? So we have mouth breathing. So roughly speaking, 80% of children that are mouth breathers do so because there's some form of blockage to airflow through their nose. And that could be because there's this things called adenoids, which are actually not in the nose, but behind the nose there's a space. The adenoids grow in that space, and if the adenoids get big, they'll be mouth breathing because of that. The other two reasons is that there could be a problem within the nose itself, and the most common thing is hay fever. So that causes swelling within the nasal passages on a nasal structure called the inferior turbinate. And with that, they get blocked. And then the other one is at the middle portion of the nose that we call the septum could be crooked. And, this is really just basic plumbing at the end of the day. So we have mouth breathing, all right? And then we go to what Amy had, which is obstructive sleep apnea. So obstructive sleep apnea means without breath. That's what apnea means. It means without breath. And they're trying to breathe, they're making the effort to breathe, but because they're so blocked, they're just not shifting the air through as they should. And that's where those choking episodes become evident. And there's a whole other sort of things that go on, but by far the main problem is tonsils and adenoids, okay? So that's what you'll hear mostly, but it's important to know that it's not the only thing that can be going on. It can be a whole confluence of things. And then we have some in-between things. So we have one condition called upper airway obstruction, which is just snoring, okay? Now people think, oh, a kid snores just like dad. Well, two problems. One, dad's snoring puts him at increased risk of having a heart attack and stroke just by virtue of snoring. Two, kids are far more vulnerable to upper airway obstruction than adults. So if the kid is snoring 4 nights of the week or more, it doesn't have to be through the whole night, just the mere presence of snoring through the night at times, 4 nights of the week or more, for several weeks to months, is a concern. And the reason for that is snoring is a noise that's made because there's some form of blockage to the breathing. So it's normal if you've got a cold or you've had a really busy day and you're just completely wiped that you'll snore, but not on a regular basis. And if it is on a regular basis, then it can, like I said, be part of this sleep disorder breathing. And then the other thing you can have is what we call upper airways resistance syndrome. So this is a situation where the obstruction is not a complete obstruction, it's a significant obstruction, but they're still able to shift a bit of air through, but they have to struggle really hard to achieve that. And that often leaves these kids, and we see it in adults too, they wake up again and they're just completely worn out because they've been putting effort into breathing just to survive through the night. So often with these children is their growth and development is affected because they're chewing up energy through the night, and also because of the disrupted sleep, it changes a whole range of body hormones that then affects their growth and development too. In terms of what time point does the duration of symptoms have to be causing permanent problems, including specifically brain damage, and it is literally brain damage, as I'll talk about later on today. It seems to be about 6 months, so it doesn't take long. So after about 6 months, we start to get an increased risk of permanent brain damage in these kids. So that comes back to, well, why do we sleep? We spend a third of our lives doing it, and just lying there doing nothing. It's kind of weird, really, when you think about it. But because it seems such a simple thing to do, and we don't put any thought or effort into it, we don't really give it the due credit and consideration that it deserves. We'll talk about, what are we eating, and we'll talk about getting exercise and having positive mental thoughts, but all those things are contingent and essential, elements of having good sleep in the background. And there's sleep quality and quantity, but without good of each, you're in trouble. So often parents will say, oh, they sleep really well. What they mean by that is they'll sleep for 12 hours. Then I say, well, do they wake up tired? And they go, oh, yeah. And I say, well, then they're not sleeping well. Because if you're waking up tired, that's not normal. That's a red flag in medicine. So not sleeping well, it affects all sorts of things like your sugar metabolism, for example. You start to get brain fog. Logical thinking goes out the window. Your willpower goes out the window. Self-control and regulation all go out the window. And that's all bad. And those things are, an indication that your brain is suffering. And that's clearly not a good thing. So, it changes things. So we see this, in adults, we see this in kids. You're chewing up energy through the night, so you need your sugar fix to basically make up for things. And we see this food-seeking behaviour, particularly obviously in adults, because they're usually the ones making the purchasing decisions at the supermarket, where in adults that are not sleeping and breathing properly, they have a tendency to gravitate towards high-calorie foods, which obviously is more the junk food type things. They know they're not good for them, and you just go, I'm going to resist, and then when you're checking out, of course, your trolley's full of stuff, and then you're eating it on the way home. And that's because there's a whole range of body hormone changes that regulate appetite, for example, that get disrupted. And your brain is just struggling to function, and because of that, it goes, it's actually missing oxygen, but it goes, I'm missing fuel. So it misinterprets that and goes, I need sugar, so again, those foods get on the table. And sleep is basically our recharge system. So, for those of us that have got mobile phones, we put it on the charger at night so it's ready for the next day. If you woke up the next day and your phone hasn't charged, you go, there's something wrong with the charger, and then you go, gosh, my phone's not going to get through the day, and you feel like you're not going to survive the way we live with these phones these days. But our brains are the same thing. Our brains are having exactly the same experience. They're not resetting, they're not recharging. Sleep is your restoration and recharge, and it really is the cornerstone of health. And the reason that children are more vulnerable is simply because they have a higher relative metabolic demand in terms of brain activity. That's because they are going through a whole learning curve of things that as adults we've mastered in the mainstay. So they've obviously got their education if they're at school, but even at the early formative years of just learning to walk, learning to talk, learning how to feed themselves, learning how to interact, learning new skills and new games and playing. All these things require the brain, and if they're not breathing well, they won't be sleeping well, and they won't be functioning well. So we talked about Amy and Sarah, now we're going to talk about Sarah. So Sarah is a noisy sleeper. She's not snoring at all, but she breathes pretty heavy, and it's certainly not a snore, and it's quite different. In fact, there's quite a few different noises that she makes, but one of the noises she makes is teeth grinding. And so often, the teeth grinding can be horrendous. For those that remember what a chalkboard is and fingernails down the same, well, that sends those tingles down the spine, all right? So it's the same with the teeth grinding. And they go and see the dentist because it makes sense. Oh, they're grinding their teeth. Oh, it's a dental problem. And the dentist has a look and they go, yeah, they're grinding really, really badly. And then just go, oh, yeah, and she's also, sleep talking. Sometimes, she's just babbling through the night. It's just gibberish, as it usually is, but it's, it's a little bit funny to listen to. And then she has these moments of panic attacks through the night where she's just completely distressed and yelling out. And when it happens, just can't be woken up properly. It passes soon enough. And they discussed this with the GP, and the GP had said, oh, this is because she's got anxiety. And she's 4 years old, comes from a good home, not experienced any life traumas. They're right, she's got anxiety, but that anxiety is stemming from the brain going into panic mode because she's not breathing properly. The most common cause of teeth grinding in children is having a breathing problem. And if you have a breathing problem of any sort, the analogy that I use is if I was to come and stand behind one of you and choke you, you're going to go into panic mode. Well, that's what Sarah's brain does every night because she's not breathing properly. That drop in oxygen is enough to trigger the panic. But the thing is that this dentist was onto it. So often the dentist, if they're not familiar with it, will go, oh, you just need a mouth guard and you need to go and see a psychologist. But the dentist is a little bit more wary of things and notices a few other things. She's got dry lips. The gums are inflamed. She looks inside the mouth and the arch, the roof of the mouth, which we call the palate, is narrow and sitting higher than it should. And then the dentist starts asking these breathing questions, and it's like, yep, apart from when she's grinding her teeth, she's got her mouth wide open. The back of the throat looks okay, so they start to think, all right, if they're mouth breathing, like I said, there's probably a problem with the nose. So again, off to the ENT, and again, in this scenario, it was found to have swelling inside the nasal passages really badly. And often in further discussions with things would wake up in the morning and would have sneezing fits, like 20 bouts of sneezing and having to blow a lot of mucus out of her nose first thing in the morning. Sarah's got an allergy. She's got hay fever. And children with hay fever that end up with a blocked nose are 3 times more likely to need braces because they end up with crooked teeth. Okay? So this is not an insignificant thing. The other thing is she's got a breathing and sleep problem, which again ties in with all the things I've mentioned before. And this again is the brain going into panic mode because of that oxygen deprivation. So when we come across nasal allergies, we'll often try a nasal spray and sort of talk about, look, it's probably dust because that's the common one. So things like fluffy toys and so forth are just dust magnets. And so you try the medication for a while, modify the environment. And it was a huge turnaround. The breathing was clear, quiet, to the point the parents actually, a bit like when the baby stopped crying, you sort of start to worry that they're okay because you're so used to the crying through the night being that moment of reassurance, and as much as you wish they would sleep through the night, when they stop crying, you start worrying that they're not crying anymore. Well, they got so used to the noises that, she was so quiet, they're actually going into panic mode that she was okay. So then the parents went through a phase of anxiety. So what's going on in simple terms? When we break it down the anatomy, we breathe through the nose, so the nasal passages. Then we have that space behind the nose. Then we have the mouth, and we have the space behind the mouth. It's just a cavity that you can see. And then we go down into the lower part of the throat, and then we hit the voice box. And all those elements of the airway need to be clear for the breathing and sleep to be adequate. So I've made a few things in mention already. I've mentioned about how the nose can be crooked, and in this case of Sarah, about how the allergies can cause these inferior turbinates to swell up. And then when we find these conditions, and we treat them with the allergies, it's usually something airborne, so dust mites the most common, but the other things we look at are things like grass and pollen, mould, animals, cats, dogs, those sorts of things. And then we also see it if they're in families of smokers, because the cigarette smoke is an irritant and that can cause swelling and congestion inside the nose. So we sort of, kindly suggest to the parents that smoking around the kids is not the best thing to do. Or the middle part of their nose is crooked, so that's called the septum. It's usually off-centre because of trauma, and it's not that uncommon. If we look inside just a baby's nose from, in the first few weeks of life, roughly 1 in 20 babies has a deviated septum. So 1 in 20 children is off course from birth. And, the other thing is kids just being kids. They have knocks and bumps, fall over, hit their nose, all these sorts of things happen as well. The other thing that can happen, which is not as common, but just to draw your attention to it, is when we breathe in, usually the nose flares open. Sometimes the nose actually can collapse in. So with everyone wearing masks these days, if you put a mask on your face and you breathe in and out, you'll notice that the mask suctions in onto your mouth if it's a bit of a flimsy mask. Well, the nose can do the same thing. It can suction in, okay? And the other thing sometimes, which is really important, which is why I work with the dentist so much, is because the jaws don't necessarily develop properly. And the best way I can explain that is that if I just do a representation, so if this is, my thumbs are the top jaw, the nose lives on top of the top jaw. And if this top jaw is narrow, then it compromises the space within the nasal passages. So it makes the space available less than what it should be, which means that nose is more prone to being blocked. And then we get behind the nose, we have this space, which is where these things called adenoids are. Now, I know I skipped over explaining what they are, but that's because I'm coming to it now. So adenoids are kind of like tonsils. So tonsils are swellings at the back of the throat, adenoids are swellings at the back of the nose. Different part of the body, we give them a different name. They have some very primitive element of immune system function, nothing we get too excited about. And we think that these things get swollen in the mainstay because of repeated viral colds and flus that kids get. Some of those viruses hang around and then they perpetuate swelling, and that leads to problems. And then in terms of, if the adenoids, roughly speaking, are causing a 50% blockage to the space, that seems to be enough to put a lot of kids into trouble. And then we come down into the mouth. And then in the mouth, we've got these tonsil things, okay? We've also got the tongue. Sometimes the tongue can be big, not so much in children, but in adults. And that can be an element of things that we can address as well. And then the other thing that we can run into with the tongue is this thing called a tongue tie. So it's not entirely clear, but if the tongue cannot lift up properly, that's associated with poor dental growth and development, that then feeds into not being able to breathe properly. So often, again, we'll find these undiagnosed tongue ties picked up by the dentist because of the jaw problems. And when we then have a look at what's going on with, as I said, tonsils and so forth, in Australia we know that we should be doing roughly 10 times the number of tonsillectomies than what we're doing. And that's just based on the Medicare numbers that we have. And as a result of that, as I said, there's a whole cohort of children out there that have got airway problems that people are just completely oblivious to. But the reason things get tricky in my job is sometimes it's not tonsil. You look inside and the tonsils look all right and the nose looks all right. Sometimes it can be a problem in the lower part of the airway, and that can be swelling in the throat, for example, due to reflux. That can come into the throat and cause swelling around the voice box, for example. Or the voice box itself can be floppy. So some babies and infants end up with what we call a floppy voice box, which we call laryngomalacia as its special term. And sometimes even the windpipe can be floppy, so that's what we call tracheomalacia. And these things can collapse inwards as well when they breathe, and they may or may not need interventions just so they can breathe and feed properly as well. And the complicating thing about this is that laryngomalacia can lead to reflux, and reflux can lead to swelling that makes laryngomalacia worse. It's the same as snoring. So snoring in kids can lead to reflux, which can cause swelling of the tonsils and adenoids, which makes the snoring worse, which makes the reflux worse, which makes the tonsils and adenoids worse. So there's all these complex integrated things, and especially when we come across kids, we definitely tell the parents that they shouldn't be getting soft drinks and caffeinated drinks, and try and keep off, the spicy, fatty foods, because they are drivers of reflux. And then the last bit of, the vicious circle of sorts is the jawbone growth. And as I said, if the jawbones are not developing properly, so we have a top and a bottom jaw. So the top jaw, the worry is that it grows narrow, and the problem with the bottom jaw is it grows short. And by doing that, we end up with less space inside the throat, inside the nose, which again means that they're more prone to getting blocked. So let's talk about another kid. Bobby was good, but now he's not, okay? He's just an absolute disaster at school. He's disrupting the other kids. He can't sit still. And then they sort of go, look, I think you need to take Bobby to see a paediatrician. Okay, everyone's starting to think, yeah, Bobby's not quite right here. And then the paediatrician ticks the boxes for ADHD, and it's like, all right, we're just going to get some medication to get him on board. Medication for ADHD disrupts sleep patterns, so it's a double-edged sword. But the family's going, yep, he's out of control, let's just get this on board and calm him down. And then he's definitely doing better at school, The medication's doing its job, but he's getting the stimulant effect, so he's not going to sleep properly, and so forth. So there's elements here that have actually got worse rather than better. So they have a chat, and it says, all right, we're going to put him on some melatonin, you see, because that will help you get off to sleep. And they do that, but it doesn't really seem to be touching the sides so much, and so forth. It's definitely better with the medication than without, but there's still a struggle on the hands. And then the family go off on a holiday, school holidays, and then as Bobby's trying to go off to sleep, they're giving the medication, but the medications make it harder to fall asleep, so the night's pretty rubbish. And then at about 4 a.m, Dad needs to go up and go to the toilet, and in doing so, he hears these weird sounds coming from Bobby, and goes and has a look, and Bobby's snoring, but he's taking, there's a breathing pattern where every breath is getting faster and shallower and faster and shallower. And then he chokes, he startles, rouses a bit, and then falls into the same cycle. Starts to breathe. Next breath is a little bit shorter. Next breath is a little bit shorter. He's getting faster and faster and faster. And then he stops, chokes, and goes from there. And then Dad talks to Mum, and Mum says, oh yeah, I've noticed that too. And he does it all the time, and he just figured it was just the way he breathes. And then nothing was done. It was just like the parents made that observation, nothing was done, struggled through school for a long time. When he was 26, Bobby had a car accident. Nothing, unusual, except for the fact that he basically fell asleep behind the wheel, just for a micro sleep. And as a result of that, he was told to go and have a sleep study, and he's found to have sleep apnea at the age of 26. And then he was put onto the face mask, which is the CPAP, or else he won't be able to drive anymore. And in doing so, his concentration and focus dramatically improved. So much so that ADHD medication that he'd been started on 20 odd years ago wasn't even necessary anymore. And this story is real, and it's not uncommon, okay? He's one of the 25 to 50% of children with a misdiagnosis of ADHD. And they're basically not breathing and sleeping properly, and as a consequence of that, he should never have been given medication in the first place, and he should have had a sleep assessment done. If the right questions had been asked, then we would have got Bobby onto a better pathway. And one of the things that happens with this breathing problem is they get this adrenaline surge, stress hormone called cortisol, and then he's put on stimulant medication, so he's got all these things that just lead to hyperactivity and makes the sleep a mess. A whole lot of the brain chemicals linked to ADHD are off course and so forth because they're tied in with sleep. And all these kids with behavioural problems and disorders really need to have their sleep first. Bobby is just another statistic out there. So, like I said, I'm going to talk more about breathing and brain in my other talk, but just to keep it plain and simple, parts of the brain start to die. If you don't get oxygen, it's like having a stroke. We see this in kids, okay? These kids have parts of their brain dying off. And in particular, the ones that are vulnerable are the memory, the emotions, and the personality. And this has a knock-on effect. Obviously, it affects them at school, affects their IQ, and then affects them later on in life in terms of learning opportunities and so forth. Plus, it's not that great for relationships if you're snoring. And in terms of, as I said, in terms of what makes the biggest difference, the kids that develop a problem before the age of 6 have the worst outcomes, and kids that are left for 6 months or more also have the worst outcomes. So the brain is very vulnerable and very susceptible to damage, and it doesn't take long. And the earlier we get in, the earlier we fix it. What do we have to do? In children, the mainstay is surgery, and the main surgery is tonsils and adenoids, one, the other, or both. It may not be the only thing. We might, as I said, need to look at other things. So if the septum, for example, is crooked, we straighten that up. If they've got hay fever and allergy problems that hasn't settled with medication, we can go in there with different surgical techniques to relieve that. If we're struggling with hay fever stuff, we get an allergy doc on board. We look at immunotherapy for the long term, but in the short term, we've got to look at those breathing strategies be it medication or surgery. If they've got dental growth issues, then we start getting in there, getting the dentist to help us expand the jaws, develop the jaws to open up more space. And then, a bit like if you break your leg, you sort of see a physiotherapist. Well, we have this thing called myofunctional therapy, which is basically a rehab program to get things back on track, because with the mouth breathing, with the snoring, you start using the throat in ways and so forth that are survival, but they also add to problems. So we get the rehab going to get things as the icing on the cake, to get things sorted. So just to round it up, as I said, around about 20% of kids, okay, 1 in 5 kids, it's the most common chronic healthcare condition, and 95% of children are not being diagnosed, okay? They're just basically not being seen by the right people. People aren't thinking about it, which is a shame, because early intervention delivers the best results. And you know, whether it's surgery or medication or dental or exercises, you know, it's all individualised and specific to that one person. As I mentioned, I've got a book. If you want to look it up on Facebook, it's just called Snored to Death, and on that basis, hopefully I've kept to time and open to questions, because there's not been any thus far.
Does anyone have any questions?
There's probably those notes of yours. Are they about for us to look at?
The notes? So, all right, long story. I used to give my talks out until someone stole my talk and used it for their own. So I don't do that anymore. Yeah, so
the information, all that information you gave us is in the book?
Absolutely it is that, and a significant amount more. Yeah, absolutely.
The sessions are also being filmed and will be available if you join up for the Sleep Disorders Australia. There's a stall in the expo hall over there. If you go visit there, all members will get a copy of the recordings from today.
Yep.
Are kids able to use the sleep study things that adults can take home and wire themselves up?
Okay. So you've opened Pandora's box now. All right. So yes, we can do sleep studies in kids. A sleep study in children will tell us whether they've got sleep apnea or not. So the problem is sleep apnea is just part of the spectrum of sleep disordered breathing, okay? It misses things. So a normal sleep study does not mean normal sleep and normal breathing, for starters. The second thing is that we have what's called the first night effect, and that's in kids and adults alike. What that means in simple terms as an analogy is, say you go on a holiday, you sleep in some, hotel room, and it just happens to be the hotel room where the nightclub's above you, all right, and there's a neon sign flashing in through your window, and you've got rubbish curtains and so forth. You get a terrible sleep. And the next night you actually do a bit better, partly because you're sleep deprived and you sort of play catch up. So saying with these sleep study things, being wired up, it puts you in an abnormal sleep position. You might be lying on your back, which you would normally never do. And then we have what's called night-to-night variability of sleep. If we do, and this is kids and adults alike, if we do a sleep study 2 nights in a row in the same person, under exactly the same conditions, 40% of the time you'll get a completely different result. Okay? Completely different result. You actually need to do 4 nights in a row and average the data to get a representative sample. We don't do that. Okay? So that's your first problem. When it comes to kids, if you want to diagnose sleep apnea, just get the parents to video it on their phone for a minute or two, and if you know what you're looking for, you'll start to pick up on the signs and so forth. I, as a routine, do not send kids for sleep studies because I know the shortcomings in terms of as a starting point. If a kid's mouth breathing, if they're snoring, I don't need a sleep study to tell me that kid's got a problem, because that's the history. They've got a problem to start with. I just got to look at them to work out why. It's those tricky ones where I look at them and go, it all seems okay, that we might start then progressing to sleep studies, or if we're looking at some pretty invasive surgery, just getting a line in the sand as to which side of the fence they're on, to see if we can really justify the risks of that aggressive surgery. So the answer is yes, you could, but I personally don't as a routine, and most ENTs don't.